Dr. Taha from the department. Inshallah today we'll discuss nerve block for surgeries in the forearm and the head. We'll start with the innervation. The forearm is supplied by the three muscles, three nerves, radial, ulnar and median. And the skin area, this lateral skin area is a branch supplied by lateral cutaneous nerve of the forearm, which is a branch of mus cutaneous. The medial cutaneous skin area supplied by medial cutaneous nerve of the forearm, which is a branch of the medial cord, and the posterior cutaneous nerve, posterior area supplied by posterior cutaneous nerve of the forearm, which is a branch of the radial nerve, and this branch originated at the level of the spiral groove. The entire hand is supplied by the three nerves only. The ulnar supply in this 1.5 finger entirely medial part of the arm of the hand. This lateral 3 fingers and a half and supplied by medial nerve, but take care that the ulnar nerve also supplies some muscles here. So this is not purely by medial nerve. And in the dorsal surface by the radial nerve. Surgeries of the hand, you can block the inhaled innervation at the level of the axilla, which is axillary block, but we prefer to do forearm at the forearm level. This level you spare the motor function of the elbow and also you spare the motor function of the wrist, so the patient can move his wrist. And as we said, we can give selectively either ulnar nerve alone or the radial nerve alone, or we can combine both techniques. For surgery in the finger, you can simply insert here, give the ring block, and the ring block will be enough to cover the entire finger. If the surgery is purely in the medial part of the hand, here, you can simply give the ulnar nerve block. If the surgery is solely method for the ganglion in the extensor part here, you can give simply the radial nerve alone, will be enough. But otherwise, if the surgery in the palm, I prefer to give the three nerves, the ulnar, median and the radial nerve block at the level of the forearm. For the forearm surgery, you can give infraclavicular block, and for anesthesia, we consider this the first choice, or our first choice. You can give axillary block, but the problem with axillary block takes longer time, and success rate in our experience is not like infraclavicular. And we prefer also the elbow block. In the elbow block, you spare the motor function of the shoulder, and you spare the motor function of the arm, of the elbow. So this he can start eating immediately after surgery, and he can use his hand. But the problem with elbow block is that you need multiple injections. It's a nerve at this level are discrete, and so multiple injections are needed, as we will see. So we prefer this technique to be the main analgesia for forearm, especially if the patient has received general anesthesia. So after we put him to sleep, we give them this injection. These blocks can be also used for anesthesia, and usually we ask the patient what he prefers. If he prefers to give him a single injection like infraclavicular and to achieve, but the hand will be blocked, or to give him multiple injection and he can use his arm. Arm is used and the patient, these blocks used for analgesia, there is no problem. It covers general anesthesia, will cover the arm tourniquet, and no additional block is needed. But if the arm tourniquet is used and these blocks are used for anesthesia, so arm tourniquet should be blocked. And we find that is only muscutaneous nerve block will be enough to cover the arm tourniquet, as we show in our previous videos. And in this case, we give muscutaneous using xylocaine. So if I go to do forearm surgery, I give medial, ulnar, and radial using Narpen, plus the cutaneous nerve I needed. For example, if I need the surgery in the medial aspect of the arm, I'll add medial cutaneous nerve for forearm block. And if the surgery the surgeon need arm tourniquet, I will add muscutaneous. So, for block of the ulnar nerve and medial cutaneous nerve of the forearm and the medial nerve, you can block it in this position. This is a very good position. The hand is stable and it's very simple. You can give the needle like this, as you see now. For the radial nerve, you put the hand on the chest of the patient. The ulnar nerve run this bony part is called the medial ridge. This is the medial ridge of the humerus, and just above the medial epicondyle, these ridges exist, and the nerve is actually superficial, just subcutaneous at the level of this ridge. If you go slightly distal, this ridge becomes the epicondyle, and the nerve will pass behind the epicondyle. Look as now, the ridge becomes the epicondyle, and the nerve come here behind the epicondyle. But at this area is tight, so we don't usually do block here. So usually to block the ulnar nerve, we block it at this level of the medial condylar ridge. Later, the ulnar nerve runs slightly between the muscle, then it comes in the mid forearm level, it becomes accompanied by the artery on the medial side of the artery. As you can see, at this level, the medial nerve, the ulnar nerve become just medial to the artery. So for forearm block or for hand surgeries, we do the block at this level. For the forearm surgery, we do the block at this level here. Okay? At the elbow level, as we can see here, this is a brachial artery, and on the medial side of the brachial artery, you can find the median nerve. Once you go slightly deeper distal, the nerve becomes running between the two head of pronator teres. So this is the two head of pronator teres. In the mid forearm level, the nerve is spot identified between the superficial flexor digitorum and the profunda digitorum. So between the two muscles, the nerve can be seen easily. So in the hand surgery, we prefer to block the nerve at this level. For forearm surgery, we prefer to block the nerve at the elbow level. Okay. Okay. Come from posterior from the spiral groove. It run like this and go here anteriorly and path anteriorly all through, especially the superficial branch, until it's the superficial branch at this level become coming to the snub box on the dorsal side of the hand. So if you want to block the radial nerve for surgery in the posterior side of the arm, so you have to block it at the level of the spiral groove. If just for the forearm surgery, for example, anteriorly here or something, so you can block it here at the level of the humerus, about 3 fingers above the epicondyle. But if you block it for the hand, you can block it anyway here. The superficial branch alone is enough. So as you can see in the spiral groove, this is the humerus, and this is the radial nerve, and this is a triceps muscle. And at this level, the nerve is lying here, direct on the bone, and it gives its posterior branch to the forearm. So if the surgery in the posterior cutaneous nerve, concluding the posterior cutaneous nerve of the forearm, we block the nerve at this level. But if the surgery is not in the posterior cutaneous nerve, he does not need the posterior cutaneous nerve of the forearm, I prefer to block it about 4 fingers or 3 fingers above the lateral epicondyle, where the nerves, the radial nerve is rounded and lie anterior to the humerus. Take care that at the elbow level the nerve becomes flat, and so it's not clear. As you can see here, this is the radial nerve here. If you go distally, the nerve will become flat and its block will not be easy. Look, the nerve, the nerve is flat, and slightly distal the nerve will divide in many branches. So I prefer to block it 3 fingers above the epicondyle here, where the nerve is rounded and complete, so you can block all branches of the radial nerve. So this is the elbow. At the elbow, this is the radial nerve. Follow this nerve and it will give the posterior interosseous and give the deep branch, but we follow the superficial branch until it accompanied with the artery, as you can see. So this is the superficial branch, and so we can block it at this level. Take care that if slightly distal, the nerve will go to the other side. Okay, go. Yes. Fantastic. Now we have 2 important nerves with our cutaneous nerve of the forearm. This needed to be blocked if the surgery or the skin incision at its distribution. The first one is the medial cutaneous nerve of the forearm, and I'll show it to you. And the second one is the lateral cutaneous nerve of the forearm. The lateral cutaneous nerve of the forearm, usually it's a branch of muscle cutaneous, and usually you will not see, but we inject the local anesthetic just deep to the cephalic vein. We put the probe on the elbow crease, and we're looking to identify the cephalic vein, and we inject local anesthetic just deep to it. The medial cutaneous nerve of the forearm lie in the superficial subcutaneous area between the median nerve laterally and the ulnar nerve medially. And as this is, as we said, this is a brachial artery, and this is the median nerve, and the other side you can find the ulnar nerve. As you can see in the subcutaneous area, you can find this nerve clearly in some patients. And sometimes you might find many branches of the medial cutaneous nerve of the forearm. If you couldn't find it, you just can infiltrate this subcutaneous tissue with local infiltration. This will be enough. This patient has a ganglion here, and the ganglion have a bone cavity which will be taken a graft from radius. We give him elbow block as radial nerve block and median and ulnar nerve block, as well as we'll give him the muscocutaneous. We'll give him muscocutaneous. These 4 nerves is enough to block the forearm and to do the surgery, as we'll see inside the surgery. The sensory area here. في أي وجع طيب؟ For motor, you close your hand and tell him to open his hand. افتح ايدك كده طيب. Nothing. For median nerve, it's supplying mainly the flexor of these nerve fingers. So you ask the patient to flex the heart. اتني صوابعك كده. And for sensory, you can pinch him in this area where it's supplied by the median nerve. For ulnar nerve, it supplies this area, muscles and bones. So you can ask him to flex the little finger. اتني صباعك ده. And for pain, you can just pinch him in the ulnar area. Muscocutaneous give this area of the skin, and it's only sensory, so you can ask him by asking him to, if he feel pinching here, this, and it can give motor to the biceps also. For the posterior cutaneous nerve of the arm, branch of the radial, you can ask him if he feel pain here. Okay, thanks a lot. اوكي، لا تعرف تتنيه كده. ايوه